Gopal Munjal before. So before I start my talk and before they set the slides right, let me make a few comments. You gave a comment, educational system, we don't know each other, let me also say that. For schooling, I will differ on that. Things have changed. Our schooling program has actually improved tremendously. I come from Gurgaon now. My grandchildren study in some of the very good schools, and I admire the way schooling is going on there and the way children are coming up. And once again, a healthcare forum. I do not think that as a medical profession, we in the international forum by any standards have taken a vaccine. We are in the forefront. So healthcare forum, I actually will say with pride that healthcare, our doctors across the world, we have done wonderfully well. We are respected across the world. Let me also share with you, I have traveled to about 38 countries in this world. Anywhere and everywhere we have gone, Indian healthcare system, Indian doctors are appreciated. Withdraw the Indian doctors from England, NHS will collapse. Withdraw them from US, they will collapse. Withdraw them from Middle East, they will collapse. So since they are giving me time, I thought let me talk about it. So that's about all. We'll probably meet over lunch and have a chat on these aspects. So my ideas were slightly different. Thank you very much for that. Please don't mind it because I thought I must say this. Now, the organizers have asked me to talk on technology-led hospital management, challenges and opportunities. Oh, in a setup like this, you need to start. No, they're still showing stable. So I probably will. I probably is going to. See, my idea was to show the questions to them. Please do it. Thank you for doing that. In an IT conference, this kind of thing should not happen. But anyhow, the fact that it has happened. So the topic is technology-led hospital management, challenges and opportunities. Let me introduce you my panelists. I think there is one change. Dr. Gurveer Singh, all of you know, he is the Regional Medical Director of certain areas in Fortis. He's also been my ex-colleague when I used to be in Fortis. Dr. Rajesh Bhaskar, I'm told, is not there. Dr. S.S. Gill, Medical Director, Shelby Hospital, Chandigarh. Dr. Sushin Bajaj, Founder Director, Cygnus Hospital, Delhi. Dr. Preeti Nanda Sibal, she is the CEO of Medischool and Medical Director of AV Hospitals, New Delhi. And Dr. Chandrasekhar Sibal, Executive Vice President. So you're the better half. You're the better half. So that is the woman power. So when you're not there, she got you here. So I really thought, let me appreciate you. And I'll be a little bit choosy. Let me also tell you that I tried to fix up the questions, but I will try to fill in the gaps and give you where I want the answers. Now my first question goes to Dr. Gurveer, and I know you can't see the slides. The question is, technology as a tool for improvement in healthcare and hospital administration is not appreciated by doctors and health professionals in the right spirit. Do you think technology proves handy for the management as an important tool? If yes, how? Do I need to repeat it? No, okay. So, I'd like you to speak on that and give your views.
All right, we take it part by part. Technology as a tool for improvement in healthcare and hospital administration is not appreciated by doctors and health professionals in the right spirit. Now, this is a question which probably it identifies itself with what we call a coin, which has got two sides. When we studied, we didn't have Auntie Google with us, but we did. I think we did well for our professions and in our professional careers, and we achieved what we had to do. Having said that, as time has passed, and small things, I'll touch upon very small things. When we went in for post-graduation, the books had changed. When we came out of whatever we would say, the first part of the career, first innings, into the second innings, we found that unless you were technology savvy, you are a misfit in the corporate world. Why do I use the word corporate world? Because when we entered into the corporate world about 15, 16 years back, I bring myself back to that point in time when the entire thrust in healthcare was technology-led. Huge amounts, huge sums of money had gone in. I know Munjal will be upset with me because I still use two fingers when I type on my computer.
I do the same.
But I did adapt myself. I may not have the speed of a stenographer, but I can still type very well. And that, I must say, in some way, was a conflict in my mind, because when you're in service, you are used to only hard copies. Everything you do is on a hard copy. And this was something which unfazed me. But I will not accept to be a defeatist and say that it's not been accepted in the right spirit. Yes, there are people, I will confess, that who are super specialists, but they shy away and they have their number 2s or 3s do their work for them on the computers and such like. That's only one part. Think about it. Most of us have the privilege of being married. You are fairly robotic in your house. You would hate to have another robo come and tell you, do this, do that. I mean, even your computer looks at you and says, press enter, press so and so. For God's sake, that's not technology which is in conflict with you. That is just the way technology has been made. Do you think technology proves handy for the management as an important tool? Yes. It is definitely, for management, it's a very handy tool when it comes to stores, inventory, finance, algorithms, in management. We do away with so much of paper. We do away with so much of inaccuracy. We can do whatever we have to do, but we have to archive. And to archive would mean you have to have warehouses where you put your records and such like things. But if you have the proper technology, you can archive and yet be bereft of the burden of having volumes and volumes of paper. In management, there has to be a quick recall. You cannot have a quick recall if you have paper records. And of course, yes, one more very important thing. The doctors are often maligned for their bad handwriting. But if you're using technology, that is not seen.
Yeah.
And you're legible, you make lesser mistakes. Because there you feel, when a mistake is about to be made, you have a drop down which comes and tells you, hold your horses. So I do feel technology in management is definitely an asset.
Okay, thank you. Thank you very much for a very elaborate answer. I totally agree with you. And let me also say this. Anybody from the audience, if the time permits, will permit questions in between. Any other panelist wants to come in with a comment or wants to differ, but let me also warn you, the number of questions are 29, we are at the first one. So,
just a small comment.
Yeah, please.
Apologies in advance. I take slight exception to the question itself. It says it is not appreciated by doctors and healthcare professionals particularly. I feel that there is a general sense of technological impairment and digital literacy in the entire ecosystem. It's not just doctors. If you see funders, they are much happier to give money to set up beds rather than provide enabling capability solutions, including technology. How many of your funders would come in and say that this much money is practically for the technology? They'll say, how many beds will you set up with the money that we're giving you? What will be the ALOS and what will be the RPOP after that? What will be the returns? That's all they ask you. Second, I think there is how do you say it? I don't really know exactly how to express it. But it is a handy tool, provided we can convince our entire staff, the entire ecosystem to upskill to it. Doctors spend a lot of their time on upskilling themselves on surgeries, on robotics, everything. It's not like they're not technology friendly. The best surgeons will operate the robots much, much better than any of us can. But how much time or money do we spend on upskilling them on this technology that we want them to adopt? So these two things I think.
Fair. I think what you have said and what Dr. Gurbi said, that also is fair. Now let me tell you, he pointed out two fingers. I do the same. I joined Max Healthcare in 2003 as a director. I used to have a computer in my house, which was a desktop for my kids, but I never knew ABC of it. I can tell you that today I am IT savvy. I do all my work myself and I can do better than me. So things come with practice. Anyhow, moving on. My next question is to Dr. Preeti Nanda. The technological advances in the field of medical science have outstripped our social, economic and political policies. How do you rate this technological advancement as a challenge or as an opportunity? Yes, to you.
Yeah, so I think this question is very, very real in the current scenario.
Yeah.
Because whenever we are having this discussion on how much should we spend on technology, how we should look at technology, the important question is, are these all technological advances important for us at that current state, right? So I think technological advancements are definitely a challenge as well as an opportunity. We need to make sure that what is required for our customer audience. If technology just adds to the cost to our customer, but doesn't give that much of benefit, then it becomes a challenge. But if it helps us take care of the opportunity cost
today or wait for it at a later, when it is really required to be implemented?
I will wait till it is really required.
Okay. I agree with you. Okay. Let me move on to my next question, and that goes to Dr. S.S. Gill. Technological advancement has led to increasing costs in healthcare industry. As a medical director of Shelby Group of Hospitals, will you prefer to provide services to your patients at low cost, compromising the advantages of technological advancement at the same time? So it is the technological advancement giving low cost healthcare.
Yes, sir. Now, we have latest technologies coming up, and there is no definition what type of level of technology you can provide to your patients. You cannot go to very high tech and very high cost of technology, which will increase your bill to your patients. You must cost effectiveness and its benefit to the patient. If your technology is not benefiting to your patient in the quality of your services, and as far as he spends on the technology, I will not go for that technology. So technology should be giving a better treatment to the patient at a affordable cost.
Okay. Let me move on to the next one. Thank you. My next question goes to Dr. Bajaj. And the question is, despite the high costs, corporate hospitals are bringing in the most advanced technology, raising the cost of medical care further. These hospitals are still flourishing. In your opinion, is the high-end technology contributing to their success? Dr. Bajaj, please.
So I think this is more of how we explain healthcare in the entirety, the virtuous cycle of healthcare as we call it. With better technology and better healthcare provision, better diagnostics, better decision making leads to increasing in the lifespan of every human being. We've doubled our average life expectancy since independence. But the increasing life expectancy brings in more complicated cases to us. So we've graduated from just treating malaria and typhoid and tuberculosis now to very, very complicated cases, which leads to again increased costs of healthcare, which again leads to more challenging and better equipped healthcare systems. So I think this is a virtuous cycle that is never ending. We just need to see where we need to put an end to it. We have some systems in which you'll have a third bypass for a 99-year-old patient as well happening, just because there is no out-of-pocket expenditure there and it is being reimbursed, and doctor will say, okay, we'll do a third bypass to you. And in some, we'll have a system where we will not be able to even put in a single stent into a 35-year-old MI patient because he cannot afford it and there's no treatment available to him. So I think there is an acceptance for both. The corporate hospitals will always flourish, there will always be takers for them. But we need to have a balance that every person in the community should not be denied at least emergency or life-saving healthcare because he cannot afford it due to high costs.
In a nutshell, do you think technology contributes to the success of corporate systems?
Absolutely.
The answer is yes. Yeah, thank you. My next question was to Dr. Rajesh Bhaskar, who is not there. So can I pass it on to Dr. Chandrasekhar Sibbu? Hospitals not equipped with the best technology, do they deliver inferior care to the patients, thus endangering their lives? Your comments, please. Would you like to take that question?
I think I will pass on this question.
Okay.
Dr. Gill, that is better.
Come back to Dr. Gill. Okay. I told you this.
Sir, again, as I already said, there is no definition of high technology where we should stop at the technology. So definitely technology improves our efficiency, improves our results, and we should go for high technology. But then every hospital cannot go for the latest and whatever the available in the country. So we have to compromise.
While I agree with you, my question will now be next. Shall we divert this patient to better equipped institutions or live with them? And I'll give you an example. If a patient comes with cancer prostate, you do not have robotic surgery in your institution. Will you pass on this patient for robotic surgery to a better equipped institution by telling them that you will be better off there, or will you go ahead with this? That is where the question is.
We are treating, I think, robotic system is hardly has come to India. It is very, very. No, we are treating most of the patients without robotic system.
Okay.
Oh, yes.
This is where I was trying to bring in a debate there. Whether we today are, have we reached that situation where we'll pass on a patient to a better institution? For instance, if you go to England, you got institutions which do specific surgeries. So patients are coming directly there. Those are the institutions which are well equipped. In India, unfortunately, every institution cannot come to that level. So every facility will not be available to you. So at times you get a patient who can probably get better care in a better technologically equipped institution outside, but we don't pass it on. So that is where the question was. Thank you, anyway.
Dr. Kamal?
Yeah, please.
Yeah. I just want to support what you have said. I think selection of patient becomes very, very important. And we must be very cautious of this fact that if supposing we're getting 5-10% of patients, such patients, to treat these patients, if we do not have the right technology or the advancement, we should be open to referring them to a better institute.
That's what I said.
Yes.
This is the point I was trying to bring out in the discussion. Yes, sir.
And I just have one thing to say. today. While there are hospitals which may not have matured beyond secondary care, so they may not have a super specialist. And I do agree with you on this point that the whole flock of people who come out, they come out as general surgeons. And they are doing almost every organ.
Yes.
Now perhaps our healthcare has not evolved that much that we become organ specific in our treatment. But your example of a smaller country like England and various other places where they have specialized centers, that is why they have the most brilliant care.
Yes.
To all my colleagues who are sitting here, when you are filling something which is called an informed consent, please be mindful. It is not a complete informed consent unless you have told that individual for the alternative which is available that here we do an open surgery. However, that institute has got so and so, so and so, so and so, which would be in the norms of ethics as far as our practice would be concerned.
I absolutely agree with you, and all accredited hospitals, informed consent is a very, very important aspect where you need to document each and every complication that may happen. Once again, as I said, you also need to tell them that this opportunity, you may have a better situation elsewhere, you want to go, you please go. But we do not do it. That's why I actually brought in this question. Okay, my next question again is to Dr. Gurveer. Latest technology has obviously increased the cost of healthcare deliveries. This has brought in increased cases of litigation in healthcare. Do you think technology here is proving to be a challenge for healthcare industry? This is related to litigation.
Latest technology has obviously increased the cost of healthcare. When we had the front winding and the finger dialing systems on our table, they would cost us X. But when the mobile phones were introduced, they were X into 20. Then came the smartphones, so and so. When the introduction of a technology takes place into any industrial space, the initial years bear the brunt of the expensive cost. Slowly, the costs do reduce with other players making equipment of equivalence. This has brought an increased cases of litigation in healthcare. Could you explain what you want from me?
I didn't want to say that, but one or two examples in the market where people have been charged 15, 16 lakhs in different institutions. People have taken them to courts. That's mostly cost related, basically. Hospitals are not at fault. Doctors are not at fault. They know it, you know it. That's the point I wanted to make.
Okay, so let me be clear on this aspect. In my previous subject matter talk which I gave you, commodification of healthcare reflects every facility provided as a business case. So a person who invests wants to get a return on investment. However, if it is unrealistic, I feel the rise in litigation in healthcare owing to such a thing would definitely be there, because I will tell you why. There are models. There are models in which the control of cost has been shown, like the Narayana Group, like the Arvind Eye Hospital Group. These are some of the very powerful and very, very purpose-driven healthcare organizations where they have controlled costs, yet not gone into bankruptcy. So, do you think technology here is proving to be a challenge? Not really. If you can still draw a sample with a vacutainer, you don't have to go for a laser-driven sublingual thing where you get a microliter and you'll do the tests like a CBC and so and so at the point of care. So it's not required. People, the legal dictum is individual with a reasonable set of skills and contemporary available appliances can render adequate medical care.
Now, while I agree with you, but I'll put another question before moving on. Today, when we are doing root canal, if you know the latest technology, laser cleaning of root canal has come in at an increased cost. Yes. Now, you do that and you charge another 5,000 and the patient comes back in the night or gives you a ring in the night, I'm having acute pain, you still haven't cleaned my tooth. So, do you think that is a propagation of a litigation or is it a litigation material? We expose the person to improve technology, obviously we charge, and in case it fails, then do we end up into difficulties?
The law has been kind to give this right to the patient, that if there is a failure of a therapy or a treatment, and if it was not done up to reasonable skill, or if it was not done as it should have been done, as per the prescribed thing, yes, you are in for a litigation. But if you have gone for everything which was within yours, because the ambit is, if I am to do a root canal for 20,000, I have already told you that no doubt I'll be using air rotor, which will give you much better, lesser pain, and that little jiggling will not be there and such like. Again, it comes to the whole thing. Jitna chini डालोगे उतना ही मीठा होगा.
Yeah.
So if it is, like a very crude example, you find guys who go for marriages, they don't say that, pardon my saying it, but they look for, okay, there is a bar here. They're not saying that, why didn't you put a black label or some, good scotch there. उन्होंने लगाना है तो चक्कर आना है. ठीक है ना? They love the effects rather than the taste at that given moment. But if you want the effects and the taste to be good, be prepared to pay.
Okay, thank you. Yes, please. Any comments?
Dr. I just wanted to add that I think informed consent plays a very, very important role in such cases. And the customer definitely has the right to choose the type of, treatment he wants. Yes, for us, in current scenario, informed consent. And when we say informed consent, it is important for all of us to know that it should be only in English. It should be in a language which the patient understands, and you don't just have to read it, but you have to make sure that everything is understood by the patient.
That's a very important message which I wanted to convey. He's elaborated very well. And the message you gave of NH, Narayan Hirdale, they are also living on numbers, producing low-cost quality care. So I think this is another aspect we need to bring in. So we should also think on numbers. What happens in corporate institutions, we provide the best quality. We make it most expensive. Numbers are little, the management is asking for more numbers. You're not able to do that, and it doesn't become cost effective. So NH, Dr. Devi Shetty's group, has brought in a fantastic example. He's brought in one hospital in Gurgaon now, he's brought in one in Delhi, and I think probably in Jaipur also. So northern India, probably their presence might increase, things might change. So,
see, there is another aspect to what these groups who have been able to minimize, economize on the cost is that they have para-trained their staff into doing some of the duties which were being done by the doctor himself, which means asset-saving time. Like, for instance, harvesting of a whale. They have specially trained nurses who can harvest the whales for their CABG, which saves the time for the doctor to do only the anastomosis.
So that's a very good example. Thank you. You want to say something, please?
Yeah, sir, I just wanted to say that the linking of technology with increasing costs with litigation might not be reflective of the total reality of the system that we see here. I think the litigation is more related to the payment system rather than the total payment. So once you have point of service costs and the patient is getting money at the time of service, that leads to a misalignment in incentives of the doctors and the patients. Do we think that technology is lesser in Northern Europe or in UK? There is the amount of litigation there is almost negligible. Why is
Where?
In Northern Europe. If you see Scandinavia, the amount of litigation would be, I think, less than 5% of what we see in the US. So what is the difference? I don't think the technology is the difference.
No.
Technology, the thing is that at the point of service, the patient is not paying. So there is no misalignment of incentives. Right now, what is happening in US and India is progressing towards that also with the increasing insurance cover, is the doctors are incentivized to operate. So the doctor has an incentive when you fall sick. You have a heart attack, you come to me, I will put in a stent, I will get paid. But you don't want to have a heart attack. The patient is not incentivized to have a heart attack. His incentive is in staying healthy, in primary health care, in actual diagnosis before the treatment starts. So the doctor does not have time to counsel him on his diet or exercise or anything, he is too busy in the cath lab. I think that is where the litigation starts, the lack of communication.
Transition.
We must earn credibility. Public don't have faith in us. Unless and we explain them well that we have a better technology, that is why we are charging more. Most of the people are not seeing us that we are serving them, we are getting them service. They think that we are charging too high, and you can see the results, our court cases, our public opinion demonstrations, and we must earn the credibility and we must be transparent. And people don't think that.
I think I agree with you. I tried to link in the technology and the cost, and as the technology advanced, I tried to link the litigations with the failures, and obviously communication. That's a very important aspect. If you're not communicating to your patient very well, patient will be at a loss. Once a complication has happened, if you tell them at that point of time that this has happened, patient doesn't accept it. You see, I'm an anesthesiologist. If I, as an anesthesiologist, I'm going in for a bilateral TKR in a 75-year-old female or male, and I don't explain them that I will do one, if all goes well, I'll permit my surgeon to move with the second. That's my protocol. I will never commit them on day one or right in the beginning, you'll go bilateral. Now if I don't do the second one and they come and sue me that you didn't allow and the surgeon says this man didn't allow. So it is our communication, it is our informed consent, which is very, very important. Informed consent has to be done by the bedside of the patient. After the patient signs, you countersign. What happens in our institutions? RMOs are signing, surgeon never explains. Things never happen. Anyhow, I think this is what was the concept. So I'll move on because we've got a lot more to talk. Now, this is Dr. Gill. In your opinion, and this is a question which again can have a lot of debate, I'd like you to cut it short. In your opinion, hospital managers with clinical background and supported by technology as against those from non-medical background but well supported by technology, who do you think make better managers and why? Just
if you go to private sector, we have many people who are well versed in technology and they are not medical persons. And I think they are doing quite well. They are doing quite well. I am from a government sector. I am a doctor, I am a orthopedician. But when I come to private sector, they are doing quite well.
So who makes a better manager? That's the question.
I think both of them. Anybody can take up this job. Who can do it well? I am a doctor. I will think that medical men will make it better than I will think. But then I am very clear that they are doing quite good job.
I never said they are not doing good.
Yeah. So I think both comes with their own advantages. As a clinician or as a doctor, you understand what the doctors undergo when they are taking care of their patients. It is not always in black and white. There are a lot of grey areas in between, which a non-medical, it's difficult for them to understand. And I think healthcare has to come with empathy and humanness. It cannot be only numbers.
Dr. B, you want to say that?
Yeah, I want to say something.
Yeah.
Pick up a very senior clinician who's been a clinician throughout his life and make him a medical manager. He'll probably be a disaster.
Yeah.
So therefore, when the question, I think he's put a very thought-provoking question. In this current scenario, where the whole world is so litigious, you find a lot of very senior doctors in US where you have 4 lawyers to 1 person maybe. They do what is known as an MHA or an MBA and then transition
by IT network and converting single encounters to long-term relationship with our clients. Clients means patients as well as anybody else associated with the hospital. In your opinion, are you better off than your predecessors with the latest technology for management available to you at the click of a button?
I think that answer is very simple to give. I'm much better off.
I've got many other questions.
I think I'm much better off. EM and answering some problems in the hospital, going to the hospital to see a normal ECG when the patient is having gastritis. So I think these all things have been made much simpler by technology, sending a photograph of an ECG over WhatsApp or sending a photograph of a CT scan over WhatsApp to the clinician, or in my personal case in management, just seeing the dashboard on my phone all the time. I don't even need to carry a computer now. Earlier I would be lugging my bag all along, but now I just a small phone in which everything is available real time. So
basically you're much better off. That's the point I want to say. Okay. Now, my next question is to Dr. Preeti Nanda. Technology at times is making us lose the touch with the patient. In your opinion, is it damaging the patient-doctor relationship? If yes, should he adopt or discard it?
Here, what I want to add, Dr. Kakkad, is that one side of the spectrum, technology is all about improved diagnostics, better machinery, HIS and EMR. But the second side of technology, which I think still a lot of us hospitals need to touch more, is how do we use technology to make it convenient for the patient? For example, I'll share with you. So we have just launched a group of short-stay surgery hospitals by the name of Anand Bhav Hospital. The key or the vision with this hospital is that we are a group of IIT Kanpur guys, a MS surgeon, and me as an MBA. So 3 of us together thought that how can we leverage technology for patient care? And what we are doing is, we are doing focused factory approach. We are doing general surgeries and gynae surgeries. And our start price is the CGHS price in private facility. Right? And there what we are doing is using technology for patient connect. For example, when we are doing an ultrasound, the patient books an appointment online, gets a message and a scheduler when the appointment is there, gets the tips or the education the patient needs to come for the ultrasound. And that is where we do not have to spend more time with the patient. Patient has all information. Communication is better, and I think the feedback we are getting in the last 2 months is very motivating.
Yeah, I agree with you. You see, the point that I wanted to bring in, the point that I wanted to bring in here was, a lot of times we as clinicians have a look at the CT, all is well, fine, no communication. So this is where we are losing the time.
That's exactly what I wanted to say. When the healthcare started off, and I'm not talking of Shushruta days, I'm talking of contemporary healthcare, there was a particular breed of doctors known as family physicians. They were such a preferred breed of doctors because there was an inseparable patient-doctor relationship, which has got grossly dented by people who have lost the human touch as far as medicine is concerned.
Okay, so my next question again is to Dr. Gurveer. Something we have discussed in the morning. Telemedicine, I put it as I use the word as an offshoot of technology. I hope you don't disagree on that. But costs involved at times are prohibiting. Yet technology here provides an opportunity to manage more ICUs from one center. Will you recommend telemedicine in your center?
I certainly would.
Yes.
And the only thing I would request the government or the non-governmental, that is our own selves, that we should have either a self-regulation regulation for that, or there should be governmental regulations governing what is the use and who uses and what is the extent of use of telemedicine.
Okay, I think I'll move on to the next one. The organizers already warned me, but I still have 15 minutes, which was allotted, so I'll fight with you on that, don't worry. Now, this question, I can give it to Mr. Chandrasekhar Sibal. Do you think that the incorporation of technology in corporate institutions has contributed to medical tourism in a big way?
Do you think the incorporation of technology in corporate institutions have contributed to medical tourism? Yes, you can say that medical tourism is increasing in India as we see, and for medical tourism to increase also we should have the latest technologies available in the hospital, whether it is the patient record, the teleradiology systems, or the latest machineries. So the role of technology is very, very important here, and the many institutes like Fortis, the Max Hospital, Apollo's, and bigger institutes, they are utilizing now the technology in a very big way, and they attract a lot of medical tourism. And going forward, you can see that the artificial intelligence, the cloud computing, and those kind of things, decision-making systems which are coming, so that will help us, as well as that will help, or that will make the things more transparent. Okay. Because everything is, data is there, data is stored, and there is no wrongdoings, because anytime the records can be checked, what medicine has been given, all these things are now stored online. So any of the things will be transparent and better for the patients as well.
Basically, technology is contributing to medical tourism.
Yeah, it's in a big way.
So my next question is to Dr. Sujit Bajaj. Part of it has been discussed in the morning, so I'll be quickly moving on. It is said that the money spent on technology is well spent both for the management as well as for the diagnostics and clinical treatment aspect. Your comments and path direction on this aspect, please.
I think any money spent on technology is well spent, whatever we spend it on.
Yes, I agree with you. I'll consider it as a fixed deposit. If you're not using it today, you can use it tomorrow.
Absolutely. So my father was a professor in the Delhi University, and he always used to tell me that any money that you spend on education, on upskilling yourself, or on something that will serve you well, do not consider it as spending at all. Consider it as an investment. So this is an investment, this is not a spend. We need our investors and our funders to look at it and realize this as well as we do.
Absolutely. Okay. Next question is to Dr. Preeti Nandan. Technology has made a patient more aware today. Do you think this is in any way impeding in the management of patient, either at the clinical level or at the management level?
Yes, I think it is impeding because Dr. Google, somehow people have started trusting Dr. Google so much, and without even making even a bit of effort to know whether what Dr. Google is saying is right or wrong. One very important thing in this aspect which we miss is, healthcare is not same for everybody. Every individual is different, and therefore the key to your healthcare, or maybe yours is different. And it is only with the doctor's education and his expertise that the right solution can be provided.
Okay, it does, but I'll bring in another question later. You want to say something, sir?
Yeah, if you said that has technology made the patient more aware? Yes, in countries where you have data available on the websites, you can see the competence of the doctor, the outcomes of the doctor, the infection rates of the institutes, and so the patient is more aware of what he would want and where he would like to go.
The other aspect I'll cover next. Now this is to Dr. Gill. Dr. Gill, for you. It is said that money spent on technology is well spent, both for the management as well as for the diagnostics and clinical treatment aspect. Your comments and path direction on this aspect, please.
Sir, definitely. Better technology, you will get better results, and the patient will be benefited more, but it is costly. So some of the patients are too poor to spend that much cost. That is the only fact. But if you have better technology, and very clear your results will be better, patient will be benefited certainly.
Sorry, now I'm going to put you this question. I think I pressed the wrong button. Now, do you think that the availability of the latest technology in corporate hospitals in any way is posing a major challenge to the public sector? If yes, is public-private partnership the path ahead? We talked about it since you are from public aspects, so I thought everybody to you.
Sir, definitely. It has affected the government sector very badly because they are not matching the technology provided by the private sector. And I am very clear that our governments will never be able to match that technology. So there is a definitely role for private people. Yes, there is a definite role.
Okay.
And we must come more closer to each other.
Okay, I'll quickly rush to the next ones. This is to Dr. Bajaj. Panel-based in CGHS patient where the rates are fixed, at times are deprived of the best technology. Your opinion and advice, giving them the best at the same cost. Is that possible?
So in our hospitals they are not. I have no idea where they are deprived of the best technologies just because the rates are not there. I don't know if maybe a robotic surgery is not covered in their panels, then there may be a cause. But I don't know if that is the truth. So we need to go by evidence-based medicine. And as Sir also said, that if we can give to the best at our skill levels, the best skill levels of the doctors to the patient, I don't think there should be a cause for concern.
Cost is a concern or it's not a concern?
It should not be a concern in...
So if there is, let me put it in this way. Example-wise, we have the orthopedic cost here. A patient to a fractured neck femur. One methodology, leave aside the age group. One methodology is do the DHS, another is maybe PNF. So cost related. Sir, do you agree with this question? So, I mean, I'm an anesthesiologist, so I can improvise these questions on the spot.
So we are assuming that one of the two modalities
You
will not be covered by
you got a CGHS panel-based patient, package is this much. Fits into DHS, but the best surgery is something different. Now what will you do? Will you go for the best or tell him thank you, move on?
So again, I think it comes back to what we were discussing earlier. If and only if the particular best quality surgery is not covered by his panel, I think we should explain to him and give him an informed consent that this is what you are entitled to and this is what is the best for you. If you want to go for this,
Okay, I think they are on my head. Now, Dr. Preeti Nanda, do you think a hospital information system is a must for every hospital, irrespective of the bed strength?
Yes, I think this is
The answer
definitely.
is yes, and there are no no's. I'll move on. I need to move on because they are on my head. Now, Dr. Gurpreet, technology advancement today even guides us to the treatment of patients. Signs are picked up by the monitor and the next management step is indicated. Do you think this level of technology is a must for all the hospitals? And let me tell you what I'm pointing on. Sepsis. No. No? Let's be brief there. I probably will agree with you. I'll agree with you. Dr. Gill, simulation training is costly, but for the long-term benefit of the hospital and the patient outcome, it is challenging too. Your comments.
Sir, we should have simulating technology. It should be part of it. It should be part, and people must be trained on simulators and then put to the clinical services. It is a must.
I agree with that.
As we said earlier, it is not an expenditure, it is an investment. So think of it that way.
Fair, that's a good comment.
I think one thing here which should be done is using technology, the training needs should be identified properly. And I think that can help us keep a balance between the money we spend on training.
Agreed, agreed. Okay, now this is something we are talking about. Anybody can take this question. I think Preeti can take this question. Making people believe that the health issues can be solved through internet is a challenge. In your opinion, does internet health portals have a long-term future? Now this is a question relevant to the conference. So I thought you can take it. So I deliberately put it again.
So I think making people believe that their health issues can be solved through internet is not a challenge.
It's not a challenge.
Because they already believe that internet can help solve their health issue. Right? Yes, when it comes to giving them right care, it becomes a challenge for the doctor.
Okay, now let me put it a bit. Primary healthcare you're talking, secondary or tertiary? I suppose primary or...
Primary healthcare, yes.
Okay.
So the future, so the question I think is, do internet health portals have a future, right, long-term future? So I met the ex-CEO of Patients Like Us recently. We were at the same session in one of the educational institutions. I think the main challenge here is how do they monetize what they're doing? Where is the revenue coming from? So Patients Like Us has flipped completely from an online patient community to a trial-based portal in which they are spending out information of the patients they have, of the subgroups of very rare disease patients that they have, to trial companies mostly from China and the Middle East who are conducting trials on them. So I think the monetization will be an issue, but there will be no dearth of such portals.
Agreed, agreed.
In addition to monetization, I think here one more thing which is going to create some difficulty in this space is that results, when people will not get results and there will be more complications, they will have to come back to the right source to get it done.
That's what I said, primary health.
Yes.
Everything cannot be done. So quickly moving on, Dr. Bajaj again, staffing and labor costs can consume more than 50% of expenses of the hospital. In what way do you think that IT support can make it cost effective?
A lot actually, a lot. We have hospitals in every 30 to 40 kilometers from, if you travel from here to Delhi, I think we have a hospital in every town that you come across. And without technology, we would be floundering everywhere. So technology helps us in managing the bandwidth completely. The management bandwidth is reduced by almost 50% when we have technology at our disposal. The super specialists can be employed much more gainfully if they have good quality technology, HMS and PACS at their disposal. Yeah.
Thank you.
In addition, what we are, on the way to implementing is informing people about their responsibilities through technology. Now that takes away a lot of time overlap which was being, used otherwise, and that really increases the efficiency of the manpower.
I just use one sentence to say this, that it will not hurt the social sentiment. When you use latest technology, please try and tell the public that you are right-sizing your staff and not downsizing your staff.
Absolutely right. That's the right word. Yes, sir.
Sir, this technology we are talking in the hospital, but we should talk this technology in the management of the patient. How to take a trauma patient and use this technology where this patient should be sent, where the neurosurgeon will be there. All these things, this management, this technology is required in the management much more than in the hospital. We are doing quite well in the hospital, but management we are totally failing. Individually and jointly, government level, police level, our school.
I may say, is required at all levels.
All levels, yes, yes.
It is required at all levels.
All levels. So then we will be able to reduce the manpower, less number of hospitals, less number of
related question is my next, which I am passing to Dr. Gurdeep.
Sorry, to add to what Dr. Gill said, yes, very right. If we do that, we can also increase the predictability of the thing. And what, so we have started doing this, that depending on the symptoms, we are grading it with the findings we see intraoperatively. And hopefully in another few months, we should come out with the results and how it has increasing predictability in general surgeries.
Okay, thank you.
Sir, other thing, we must find technology for our problems. Most of us, we are learning technology from other than trying to implement it. That is our problem. We have a large population. We have an uneducated population. We have persons without insurance, without government support. Most of the people are spending from their pockets. Poor farmers committing suicide due to medical bills and all those things. So we should use this technology to solve these problems, not that whatever is available in US and that should be shifted to Delhi.
I'll agree with you, but it is through media. What Mr. Modi is telling you is through technology. Ensure yourself. So technology is being used at different levels. So it is technology which is passing on the information to those who are lesser educated than you and me. You see, this is what I'll say. So technology is available to us. It is going to be useful to us at any time and every time. And let me combine two questions for Dr. Gurbeer next. Having the latest technology in your hospital, is it an asset or a liability? Does it help you in attracting the right manpower? And does it also help you in increasing the core business, which is my next question. Interest of time, I'm combining.
Okay, so I take the first question. Having the latest technology in your hospital, is it an asset or a liability? All right. Now, if I wear two hats, if I am to see the future of my group and where it is going, and how I am placed in the milieu of the healthcare, if I have 2-3 potential competitors breathing down my neck, if I have something of the latest technology which is a positioning element, may not be a very functional element, but a positioning element, yes, it is an asset, not a liability. However, if I have to give only contemporary, for instance, now you mentioned the advantages. In a company like ours where we went in for 4 robots, was with a particular thought in mind. It was not just positioning, but it was an asset in the group. In so many of the modalities. And that is where we did attract the right manpower, because people said, get your robo first, then we will.
So the answer is yes. That's the answer I want. And it does help you in your core business also. Okay, I think that's the last one or two. Electronic healthcare data to your mind is a useful tool or a double-edged. I think let me skip this also. The next one also I'm skipping. That's on Pulse Polio because the panelist is not there. And let me bring you to the last question so that, and unfortunately that's again to you, sir. We are today talking about robotic surgery, simulation, medical tourism, medical legal aspects. For all these, at all times, we need to be updated with technology. We'll appreciate your comments as to what you feel technology in healthcare management is a challenge or an opportunity, is going to make life easier or difficult for us. So a brief comment and I'll close it after this. From you, sir. Dr. Gurbeer. Yes. I'll skip 2-3 questions so it doesn't come to you again. Can't help it. So, is technology basically going to make your life easier or difficult? Let me put it that way. We need to be updated.
Yes, so in many forms it has already been answered. Yes, technology will make my life easier, and I accept your thank you.
Okay, thank you very much to all my panelists.